Don't wait to vaccinate. One way we're supporting more vaccination is through the Your Shot at a Million and Cash for College summer drawings. 2 weeks ago, we announced our first winners, and today I'm excited to announce our second round of winners. Remember that we still have 2 more $1 million drawings for North Carolinians 18 and older, and 2 more Cash for College drawings for North Carolinians ages 12 to 17. And there's still time to get vaccinated and be entered into our final 2 drawings. And even if you don't win cash or a scholarship, you'll still be winning by protecting yourselves and your loved ones against this deadly virus. So our second Your Shot at a Million winner is Natalie Everett. Natalie is from Pineville, North Carolina. And Natalie, why don't you come join me over here? So we wanted to ask you first, congratulations. How excited. So were you excited to learn that you won $1 million after receiving your COVID-19 vaccine?
Yes, beyond excited, grateful, and just very overwhelming.
Well, congratulations for that. We are so glad to have you here. Glad you got vaccinated. And thank you for protecting yourself and others. And congratulations to you, your friends, and your family. I hope North Carolinians will follow your example. Vaccines are the best protection from COVID-19 related hospitalizations and deaths, as well as complications from this virus. Now we know that even people who had a mild case of COVID-19 may struggle with long-term effects like shortness of breath, chest pain, and brain fog. And with more contagious Delta variant spreading, North Carolinians should not wait to get vaccinated. Rigorous clinical trials among thousands of people ages 12 and older have proven that vaccines are safe and effective, and more than 160 million Americans have now been safely vaccinated. Getting a vaccine is the best way to protect you, your family, and your community from COVID-19, and that's exactly what our Cash for College winner did. Her name is Jessica Kleiman, and she is from Greensboro. And she said she was inspired by her parents to get vaccinated. And I know she's going to inspire other young people just as her parents inspired her. So, Jessica, congratulations. So I understand that you're going to be using your scholarship towards going to school so you can become a physical therapist. Is that right?
Yes.
Well, tell us how you felt when you heard about winning this scholarship.
My reaction was when they called from the state and told my parents, then my whole family was happy, started jumping, screaming, and a couple days later, they still can't believe it.
Yeah, it's pretty remarkable. Well, we're so excited that you and your mom and your sister are all here, and we're super excited for you to use this scholarship to become a physical therapist. That's great. We wish you the best of luck, and thank you for getting vaccinated, and thank you for making sure you're going to share your voice with other teenagers to make sure they get vaccinated as soon as they can. So great job, and congratulations, Mom and everyone. Thank you. She's adorable. So you can't see for those of you who can't see off screen, Jessica's sister is amazing and very excited to be on stage. So she can't get her vaccine yet, because remember, this vaccine is only for those who are 12 and older, but we're excited that once we have a vaccine that's available for everyone, we know that everyone in the family is going to get vaccinated. So thanks, Mom and everyone. So if you've already received your vaccine, that's great. Thank you so much. What I need you to do now is talk to your friends and family about why you chose to get vaccinated and share your experience. Don't wait to get vaccinated. So go to myspot.nc.gov and find your vaccine location near you. And with that, now that you've met our 2 winners and heard a bit of an update of where we are with our trends, we're going to take a few questions from some reporters in the room, and then we can move on to anyone on the phone. So if anyone has questions, they can go to the mic here, and if there are no questions, we can move to the phone.
Hi, Dr. Cohen. Mackenzie Stasko with CBS 17. Just wondering, with the Delta variant and the cases rising, how will this impact the state's plan for mask guidance with the school and just the state's guidance in general, knowing that cases are rising yet again?
Well, thanks, Lindsay, for the question. You know, I am concerned that we are seeing the Delta variant here in North Carolina. It's the dominant form of COVID now in our state. And what I could say, it's more contagious, it is stronger, and it's showing up in our numbers. Our cases are way up. As I said, just 2 weeks ago, we were averaging about 300 cases a day. Today, we had 1,000 cases. And what I could say is 99% of those cases are in folks that are unvaccinated. It's why we're here to remind folks that you really need to get vaccinated as soon as possible, because we know that the CDC continues to recommend that those that are unvaccinated wear a mask, right? Because we know the unvaccinated are still at risk. Now, those that are above the age of 12, you can go and get a vaccine today, which is great news. But we know for our kids who are under the age of 12, they're going to remain unvaccinated. They're not yet eligible for a vaccine. And that is why we're going to continue to recommend that those who are unvaccinated, particularly our kids, are going to still wear masks. We are looking at the CDC guidance that came out last week on schools. And so our team is trying to align our guidance with that. And so we hope to have more next week on that.
Just a quick follow-up question. I wanted to know, how bad do you think that this Delta variant could get in North Carolina? Are there any sort of projections that you're looking at, or perhaps any lessons from the past 16 to 18 months that we could use to kind of control this here?
Yeah, absolutely. So North Carolina, as well as the rest of the country and the world, we've learned a lot of lessons over the last hard 18 months. A couple of things that we know: vaccines work, right? And in this particular circumstance, the vaccines protect you against the Delta variant. So we are really encouraging everyone to get vaccinated as quickly as possible. But we've also learned that there are other ways to prevent this virus from spreading, and that is, again, wearing masks. That's why we are going to continue to encourage those who are unvaccinated to wear masks, particularly indoors. We know this virus spreads more when you are indoors in a closed setting near someone for a longer period of time. So that's why we hope those who are unvaccinated will continue to wear a mask to protect themselves and each other as we go forward.
Last question. The cases that are rising and the hospitalizations, are those mostly younger people, the people who aren't really getting vaccinated, or can you give us any sort of context for that?
Sure. Well, I would say most of the cases that we are seeing, 99% of them are in folks who are unvaccinated. And when you look at who is unvaccinated in North Carolina, it is a younger population. We see more than 85% of people over the age of 65 are vaccinated. So it just makes sense by the numbers that they are less likely to be our cases now, which is great news because we knew those over 65 were at higher risk. So what we are seeing now are more cases in a younger cohort. But unfortunately, we're still seeing increases in hospitalization. And so what we're seeing is people in their 20s, 30s, and 40s going into the hospital with COVID. We just want to remind folks this is still a serious disease. It is with us. And unfortunately, even in younger people, it can cause pretty serious illness. So we're going to keep at it, encouraging vaccines, encouraging masks for those who are unvaccinated. We're not done with this yet. I think that's all for the questions here in the room. Do we have any questions on the phone?
Our first question is from Ben Sessoms with the News and Observer.
Thanks for taking my question, Secretary Cohen. So North Carolina topped 1,000 new daily cases today for the first time since May, and week-to-week vaccination numbers are continuing to go down. Are you concerned that the lottery hasn't been as effective as y'all hoped it would be to increase vaccination?
Well, thanks, Ben. You know, we are throwing everything we've got at this vaccination effort. And we know from looking at other states that using tools like the lottery or an opportunity for a scholarship did make an impact in other states. So we certainly wanted to use every tool at our disposal here. But we know it's not just that, right? There are many reasons why folks are or are not getting vaccinated. I think some of it is that folks need to make sure they have access to a vaccine, that it is close to them, and we're making sure that they know that there are hundreds of places you can get vaccinated today. You don't need to have an appointment. I think there are others who have a question still about the vaccine. We want to make sure those folks know it is safe and effective and free. So we want also folks to get really good information. So make sure that you are getting good information about that vaccine, whether it's from our department or the Centers for Disease Control or another reputable medical source about this vaccine. So we're going to continue to focus on many ways to reach folks. We also want to make sure that people who are vaccinated are talking to others about their experience. We've found that really helps people make decisions about whether or not to get vaccinated. So if you've been vaccinated out there, I'm asking for your help. Please talk to your friends and family about why you got vaccinated and convince others to get vaccinated as quickly as they can.
We have a follow-up question from Mr. Sessom.
Just one quick follow-up, Secretary Cohen. So as many as 40% of adults are still unvaccinated in North Carolina, and you were just talking previously about the Delta variant and how it's spreading in North Carolina. What's the likelihood that we could see outbreaks like we did over the winter, if vaccination rates remain low? And what is your message to North Carolinians that still haven't been vaccinated?
Well, I am concerned for our North Carolinians that have not been vaccinated, particularly with this stronger Delta variant of COVID that is now predominant here in North Carolina. I think folks really need to go out and get vaccinated as soon as possible. We have already seen outbreaks across the state here. I don't want to see anyone else get sick and certainly not lose their life to COVID, particularly when we have this powerful tool to prevent it. So please, please, please go out and get vaccinated.
We have one final question from Brian Anderson.
Hi, I have two questions for you, so forgive me for that. I just wanted to ask a hypothetical question for you, Dr. Cohen. If you are, as a vaccinated person, and you're going to a place where there's a large, say you're in Bladen County or in Hoke County, as a vaccinated individual, would you feel safe going to that county and being unmasked, or would you prefer to wear a mask?
Brian, thanks for that question. What we have seen from the data is that the vaccines that are available right now are protective against COVID and its variants. So I do feel comfortable and protected. However, there are lots of folks with different reasons to want to wear a mask, and I encourage anyone, nothing wrong with wearing a mask for some extra protection, even if you are vaccinated. So again, there may be folks with more chronic diseases or older, or their immune system is weaker for whatever reason, and they want to give themselves some extra protection. Absolutely nothing wrong with that. I feel protected with the vaccine I got. Remember, I got the Johnson & Johnson vaccine, the one and done vaccine. I do feel protected from COVID, but this is where we all need to work together. The more people in North Carolina that get vaccinated, it protects each other, right? The less virus we have circulating here, it means we've protected each other here in North Carolina. It gives this virus less of a chance to change or get even stronger. So we have work to do, and I'm hoping everyone's going to get vaccinated as soon as they can.
And I believe Brian has a follow-up question.
Yes, thanks for that. One concern I've heard from unvaccinated people is they don't trust the vaccines because they're only authorized for emergency use. And the fact that it's only approved for emergency use is also making some employers feel unable to mandate their workers to get vaccinated. Are you pushing either publicly or behind the scenes for the Food Administration J&J vaccines full approval?
Sorry, Brian, we lost you for a bit of it, but what I would say is we've seen 160 million Americans safely be vaccinated, and we want to see many, many more. And while this was authorized for emergency use, it still had to go through the rigor of clinical trials, review of evidence, and now we continue to look at safety data day over day over day. And what we are seeing is, right, we know that this is safe and effective vaccines that are out there. I know that Pfizer has already put through their paperwork with the FDA for full approval. So I'm hopeful that the FDA is working as rapidly as possible to get to full approval for the vaccine. And again, but that's not slowing down our effort. We're going to still make sure that everyone gets vaccinated as soon as possible. And it is my hope that the FDA looks at the data for the millions and millions of Americans that have now gotten safely vaccinated and will move to full approval as quickly as they can. All right, I think that was our last question. I'm grateful. Thank you to Natalie and to Jessica and their families for being here. I'm excited to announce these 2 new winners. Remember, we still have 2 more drawings coming up in the coming weeks. Get vaccinated because it protects you and your family, but if you needed one more reason, maybe you will win $1 million. Okay, don't wait to vaccinate. Thanks, everyone.